Dr. Partha Das. Now, he holds the position of Deputy Medical Director and Consultant in Reproductive Endocrinology and Infertility at Orchid Fertility in Dubai Healthcare City. That's in Dubai. He's got over 19 years of experience in this field. Good morning, Doctor, and welcome to the show.
Good morning. Thank you so much for having me here today.
Today, we're talking about a hugely controversial topic.
I know. I understand that, and it is a very sensitive topic. It is a very, I would say, a very high-end topic in the sense that it is about making a life.
Right.
And making a life is not so easy. So now technology and scientific advancements have made these things quite easier. We are able to do a lot of things, and with those technology, we are able to help those subset of population and the couples out there in the community
Correct.
who were struggling to achieve a pregnancy to take home a baby.
Correct. So today we're talking about IVF. So what does IVF mean to a layman who you need to explain IVF, the terminology? What is IVF?
So IVF stands for in vitro fertilization, which means that we fertilize your embryos outside your body. So the next question you might ask me is that what is the name given to fertilization which happens inside the body, and it is called in vivo fertilization. So in vivo means inside the body and in vitro means outside the body.
Correct.
So when we understand that the physiology is not up to the mark in the sense that the normal process of the sperm meeting the egg and fertilizing it and implanting into the uterus is not happening, then what we would do is we grow your eggs by giving some hormonal injections, and then we harvest those eggs out. Once we get these eggs, then the sperms are taken, and for each egg we inject a sperm. The process is called ICSI, intracytoplasmic sperm injection. And then we culture these embryos in the lab for up to day 5 of life, which is called the blastocyst stage. And at this point in time, these embryos are then taken and replaced back into the uterus, one at a time, one embryo at a time, so that you achieve one baby at a time. So this whole process is in short called in vitro fertilization program or technique.
Okay, great. So doctor, I'm sure the process would be different for every individual, right?
Yes.
So on an average, how long does it take?
Once upon a time, when we used to do the IVF program, the process used to be for a duration of, let's say, around 17 to 18 days.
Correct.
Where we used to harvest those eggs, and then we used to culture those embryos in the lab and replace it back into the uterus, and then wait for another 12-14 days for the pregnancy report to show that it is a positive pregnancy test or a negative pregnancy test. Now, with amazing scientific advancements in the vitrification of the gametes that we do, like when we can freeze those embryos, we do the egg harvesting procedure, and after that, the lady can go back home.
Right.
The embryos are kept in the freezer, and we do not replace the embryos back into the uterus because of so many reasons, like hormonal reasons to avoid complications or to do genetic screening of the embryos.
Correct.
We freeze those embryos, and then she comes back again at a subsequent next cycle after 1 or 2 menstrual cycles, and then we replace that embryo back in a very natural or a holistic environment. And our frozen replacement cycles success have become much better and more than the fresh transfers now.
Yes, I know we were talking about the fresh transfers and the frozen transfers. So what's the difference between the two?
So as I said in my previous question, that when we want to make your embryos and replace it back in the same menstrual cycle, that's called a fresh transfer. But when we do a fresh transfer, we do not have the ability or the scope to screen your embryos for the genetic or the chromosomal errors, like and so on and so forth. But if somebody is a candidate where there is a past history of chromosomal abnormalities of their previous children, or there is a family history of any genetic abnormalities, or they have not had successful implantation, what we say is implantation failure, or they have had repeated miscarriages, or the lady has a high risk of having a severe complication like ovarian hyperstimulation syndrome. These are the incident cases where we freeze these embryos, and then we send the lady back home and ask her to rest for 1 or 2 cycles, and then she comes back, and then in the subsequent cycle we replace this embryo back into the uterus. So that's called a frozen cycle, because we have frozen the embryos. So that's why it's called a frozen embryo replacement cycle.
Right. While you were talking, you did mention that you asked the lady to go back and come after 2 cycles or 3 cycles, or however you deem perfect for that. But I want to understand the science behind making these individuals believe that they can have a life beyond, the normal way of giving birth.
Yes, that's where it starts with a beautiful consultation that we have with our couples.
Right.
During that time, we spend almost an hour or so sitting with them, understanding their case, talking to them, knowing about their past background and the medical problems that she has had undergone before.
Right.
And basically making up a complete detailing history for the couple. And then what we do is we tailor make, or we personalize this whole program of fertility treatment, whether she wants an artificial insemination, or she wants an in vitro fertilization program, or she is a candidate to do a genetic screening. These things are discussed, and it does not end with that. Okay, you have to do IVF with a frozen. No, then we go to the level of dissecting that terminology, like why you should be doing it, what are the pros, what are the cons, what are the side effects, what are the advantages, what is the success rate, and all these things are explained to them. If they do not understand, we again have a sitting to make them understand, and we have an amazing laboratory and embryology department where they even get to see the pictures of the embryos.
Oh, they do.
They see the pictures of the sperms and the eggs. It's a live version going on there, and they are made a part of this whole program, a part of this whole treatment, because they are the ones who go through it, and they should be knowing each and every step of the way.
Right. So what do you tell your patients who have had probably 2 unsuccessful, tries, and then come back to you and then probably say, no, now we can't go ahead with this any further, not due to any monetary reasons, but because of the entire emotional baggage that they carry? What do you tell such patients?
Fertility treatment is not so easy and not so straightforward.
Right.
It really works negatively on the woman's health, because she has to pump a lot of hormones inside her body. She has to come for injections. She has to do a lot of scans. She has to undergo a process of egg harvesting, which is under anesthesia. So it's a complete surgical procedure that she undergoes through it, and at the end of the day, it is not 100% guaranteed, right? So we have to discuss all these things, but the thing is that this is infertility all about. I mean, nature or God has given us only this 45, 50, 60% chance to achieve a success.
Correct.
The remaining 30, 40%, we really don't know. And we need to maximize. Now, for somebody who has had trials before and they have been unsuccessful in this journey of fertility treatment,
Correct.
we need to again start from basics. We need to again start from scratch. We need to individualize their treatment options. Now, if fertility implantation failures are happening and it is not giving a success, then we have to go in-depth analysis of the embryos. We have to do a very meticulous analysis of the endometrial cavity in the form of the hysteroscopy and the endometrial biopsy to check for any kind of inflammation and infections. So it is a journey of almost around 2 to 3, 4 months up until when we are ready to replace the embryos. And when we have done this kind of scenarios, a lot of these ladies, I would say 6 or 7 out of those 10 women who had implantation failures, they got pregnant and took home a baby.
Oh, wow. That's amazing. Now, talking to us more about this, I'm not going to let Dr. Partha go anywhere. You too, don't go anywhere. Stick around to Talk 100.3. Coming up next, we're going to be talking about success rates. We're going to be talking about everything to do with IVF. All the myths that you've ever heard, we're going to bust it right here. Only on Talk 100.3.